The province's stay-at-home order sounds pretty straightforward. If you're not an essential worker, stay home as much as possible except when absolutely necessary to step outside. But for many, just staying home is not that simple. In our weekly Q&A with Toronto's Associate Medical Officer of Health, one of our viewers wanted to know the rules for those who live in blended households with several children going between multiple houses. Here's what the doctor had to say.
Life is complicated, isn't it? So I think what I would say is, first off, if someone has symptoms, they test positive, or they're a close contact of someone, if you cannot isolate that person safely in the home, consider the voluntary isolation center, because I think that that's something helpful. And I think as much as possible, recognizing your household, you want to avoid any other contact with anyone else. And so while your household may be complicated the way you define it, it is the people that you live with, and recognizing that there are situations where a child may have two households, two roofs that they live under, for example, that's fine. That's their household, but to limit their contact that way. And so I think anyone who lives in these blended families or blended households, they themselves need to make sure that they have very little contact with anyone else outside the household to minimize the risk to everyone.
This week, our viewers were curious about the vaccine and how it works, as well as the new enhanced COVID-19 restrictions. For those answers, you can find the full chat on our websites citynews.ca and 680news.com. Or to go directly to the page, you can point your phone camera to the code on the screen you see right now and follow the link that pops up. For City News, I'm Dilshad Burman.